So good afternoon, everybody.
Good afternoon.
So today we will be talking about non-steroidal anti-inflammatory drugs. In short, we can say it is NSAIDs. Okay, non-steroidal anti-inflammatory drugs. Have you heard these drugs names before? NSAIDs. So these are the very commonly used drugs. Okay, worldwide. So these are the drugs which are used in case of pain, inflammation, and the fever. So most of the disease, their initial symptoms are pain, fever, inflammation. Okay, they are started with this initial symptoms. So in most of the disease conditions, we have to give this NSAIDs or non-steroidal anti-inflammatory drugs to give the symptomatic relief to the patient. Okay, for the treatment of pain, inflammation, and the fever. So these are the very commonly used drugs worldwide. So before you know the NSAIDs, you have some basic concept regarding pain. Okay, what is pain? What are the different types of the pain? So that you can able to know the drugs. Okay, so in details, I think you will be studying in the physiology, different pain pathway and all the pain receptors. You will be studying in the physiology. But I will give you some basic concept regarding pain. So pain is a neurophysiological sensation which is arising from the noxious stimulus. So this noxious stimulus may be either the external noxious stimulus or the internal noxious stimulus. Okay, external noxious stimulus like some insect bite you or some you are hit by some sharp object. So these are the some noxious stimulus. But there are some internal noxious stimulus, like we have the pain inside our visceral organs like cardiac pain, liver pain. Okay, these are the different internal stimulus. Okay, so based on that we can classify pain into two types. Okay, integumentary pain and visceral pain. So integumentary pain, they are also known as the superficial pain, which are related to skin, muscles, and the joints. Whereas we have other types of pain, that is the visceral pain, that is related to our visceral organs like liver, heart, gallbladder, stomach. Okay, these are the visceral type of the pain where we can feel like cardiac pain, okay, colic pain, pain in the gallbladder. So these are the different visceral pains. So based on the these types of the pain, we can classify the drugs accordingly. So for the treatment of integumentary pain, we have the different classes of the drug, and for the treatment of the visceral pain, we have the different classes of the drugs. So we can classify the drugs accordingly to treat integumentary pain and visceral pain. So we have two types of the analgesic or painkillers. Okay, one is the NSAIDs. They are also known as non-narcotic type, non-opioids type, or aspirin-like drugs. So why they are non-narcotic? Because they do not produce any CNS effect. Okay, only they are the painkiller. So they act by peripherally. They do not have any central nervous system effect. So they do not produce any dependence and addictive. So these are the NSAIDs. Okay, they are responsible for the treatment of integumentary pain, that is a superficial pain only. Okay, these NSAIDs. But we have that other type of the NSAIDs, other type of the analgesic, that is opioid type, narcotic, or morphine like drugs. Okay, it is a narcotic type that produce dependence and other CNS effect. So this type of the drugs, opioid type or the narcotic type of morphine like drugs, we are using these drugs for the visceral pain. But for the superficial pain or integumentary pain, we have to use NSAIDs. Okay, like osteoarthritis or for other pain, gout pain. Okay, type of a pain, they are relieved by NSAIDs, non-steroidal anti-inflammatory drugs. So based on the different types of the pain, these analgesics also classified into two types. Okay, one is the non-narcotic or NSAIDs, or second one is opioids type of the analgesic. So you should know these two types of the analgesic. So there are some certain characteristics of NSAIDs. So all of these drugs, they are non-steroidal, okay, or none of them is a steroids. They do not have steroid rings in them. So they are classified as the non-steroidal type, okay. And all of these drugs, they are used for the analgesic purpose, antipyretic and anti-inflammatory. That means these drugs are used in case of pain. Analgesic means they are painkiller, okay. They reduce the pain. Antipyretic, that means they are used for fever. And anti-inflammatory, they are used for the inflammatory condition. And these drugs do not produce CNS depression like morphine type of the drug, like opioid type of the drugs. It does not produce any CNS depression. Respiratory depression also is not there, and it does not produce any drug dependence, unlike opioid drugs, okay. But opioid drugs, they produce all these adverse drug reaction because they act centrally. But these NSAIDs do not produce such type of adverse drug reaction, okay. CNS depression, respiratory depression, drug dependence. So all of these drugs, they act by common mechanism of action. That means they act by inhibiting prostaglandin synthesis, okay, except nimesulide and the nepopam. These are the two exceptions. Rather than this, all the NSAIDs, they act by inhibiting prostaglandin synthesis. So you should know what is prostaglandin, how does it synthesized in our body. So this is very important, you should know, okay. Before classifying the drugs, you should know what is prostaglandins, because all of the NSAIDs group of the drugs, they act by inhibiting prostaglandin. So let's start. What is prostaglandin? Okay, prostaglandin, it is a natural compound, okay, that is synthesized in our body. So it is also known as autocoids. Okay, it is a type of the local hormones that is synthesized in our body, and they act nearby the site of the synthesis. So they are classified under autocoids. Okay, prostaglandin. We have other autocoids like histamine, kinins, angiotensin. These are the other autocoids. Autocoids means you should just know that it is a type of the local hormones, that is it is produced in our body and act nearby the organ of synthesis. Okay, they are known as autocoids. So prostaglandin is one of the autocoids, and they are synthesized from the phospholipid. Okay, this is a phospholipid, is a lipids which are in our cell membrane. Okay, everybody or every mammalian cells, they have the lipid layer in which we have phospholipid. You can see in this diagram, this is a cell membrane. Can you see here? Can you see this figure? This is a cell membrane. Okay, in the cell membrane we have the lipid layer. So in this we have the different lipids, likewise phospholipid also, they are in the cell membrane. And this phospholipids is acted by the enzymes phospholipase A2. Okay, this phospholipase A2 is released from our body whenever there is an injury or any pain or inflammation in our body. So due to this injury, this enzymes is released in our body, phospholipase A2. Okay, so this phospholipid is converted into arachidonic acid with the help of the enzymes phospholipase A2. Okay, this arachidonic acid is again converted into, again acted by the other enzyme. This is a COX. That means it follows two pathway. This is a cyclooxygenase pathway. That means in short we can say COX pathway. Okay, it is a lipooxygenase pathway. This is a, so this arachidonic follows two pathways, cyclooxygenase pathway and lipooxygenase pathway. So this COX enzyme acted upon arachidonic acid. And this COX also is two types. Okay, there are two isomers of COX. One is the COX1, then next is the COX2, cyclooxygenase 1 and cyclooxygenase 2. These are the enzymes, okay, that act upon arachidonic acid. And when this COX2 is an inducible type, that means it is produced only when there is an infection or inflammation or any injury in our body. So it is an inducible type. But this COX1 is the constitutive. It is a type of housekeeper, COX1. Okay, it is released in the physiological process. So it has some physiological function. But this COX-2, cyclooxygenase 2, they are released in case of when there is any injury or any inflammation in our body. So finally, there is a production of the prostaglandin. Okay, this prostaglandin, inducible prostaglandin, they are responsible for the pain, inflammation, and the fever. Okay, this is due to the COX-2. Whereas the COX-1, they are responsible for the various physiological function. Okay, this COX-1, remember that this COX-1 is a housekeeping. Okay, or it has a constitutive action. So they are responsible for the synthesis of thromboxane, and this is physiological prostaglandins. Okay, they are responsible for the various protective functions in our body. So by acting on the GIT, they act as a cytoprotective effect in our gastric mucosa, and they also help in the hemostasis. This is a blood vessels. Okay, and in the kidney, they are responsible for the function of the kidney. So this is how prostaglandin is synthesized in our body. Okay. So these NSAIDs, that is non-steroidal anti-inflammatory drugs, inhibit this COX enzyme. By acting on the COX enzyme, they inhibit prostaglandin synthesis over here. Okay. So this cyclooxygenase pathway generates prostanoids. Prostanoids means that prostaglandin, thromboxane, and prostacyclin. Okay, and lipoxygenase pathway produce leukotrienes. So this arachidonic acid follow two pathway. One is the lipoxygenase pathway that is responsible for the formation of leukotrienes, whereas this cyclooxygenase pathway that is responsible for the formation of prostaglandins. This is the same things that I have explained. Okay, this is the membrane phospholipids acted by the enzymes phospholipase A and converted into arachidonic acid, and this arachidonic acid follows two pathway. LOX, that is lipoxygenase pathway, and the second one is the cyclooxygenase pathway. And cyclooxygenase pathway is responsible for the synthesis of these prostanoids. That includes prostaglandin, thromboxane, and prostacyclin. Whereas this lipoxygenase pathway is responsible for the synthesis of leukotrienes. This is also responsible for the various inflammatory condition, or it is acted on the various different organs. So this corticosteroids type of the drugs, they inhibit this phospholipase enzymes. Okay, and inhibiting all these steps. So these are the very strong or effective anti-inflammatory drugs. Okay, this corticosteroids, because they inhibit this initial pathway, so that there is no production of the arachidonic acid. So both this lipoxygenase and cyclooxygenase pathway is interrupted due to the corticosteroids. Whereas NSAIDs group of the drugs, they inhibit this cyclooxygenase pathway, inhibiting all this prostanoid synthesis. This is in more detail form. Okay, diagram in more details. Arachidonic acid follows two pathway, lipoxygenase and cyclooxygenase, and cyclooxygenase is finally responsible for the synthesis of various prostaglandins. Again, thromboxane A2. So we have the different prostaglandins: PGE2, PGF2 alpha, PGD2, PGI2. Okay, these are the different prostaglandins. Also, this cyclooxygenase pathway also responsible for the formation of thromboxane A2. And this lipoxygenase pathway is responsible for the formation of various leukotrienes like LTB4, LTC4, LTD4. Okay, these are the slow releasing substance for anaphylaxis. So SRSA. Okay, these are known as SRSA because slowly they have the capacity to produce anaphylactic. So this lipoxygenase pathway They are responsible for the various respiratory disease like asthma, COPD. So these all the substances, they are responsible for the various respiratory problems. So they are known as the slow releasing substance for anaphylaxis. Okay, anaphylaxis. So this figure is very important. Okay, you should know, so that you can know the mechanism of action of NSAIDs. So when different NSAIDs talks, when this pathway is inhibited and all this, there is more and more production of this leukotrienes. Okay, so non-selective cyclooxygenase inhibitors, they are more responsible for the various respiratory problems. By inhibiting the cyclooxygenase pathway, all the arachidonic acid, they are towards the formation of this leukotrienes. Any doubt in this mechanism of action of NSAIDs? Hello? Are you
No,
hearing me?
ma'am.
Is there any doubt in
Ma'am,
the
can you explain it once again?
mechanism?
Ma'am, can you explain it once again, please?
This mechanism? Okay.
Yes, ma'am.
Okay, all the mammals, we have the cell membrane, no? So in cell membrane, we have the different lipid layers. Okay, that is, we have the membrane phospholipid. So this membrane phospholipids, they are acted upon by the enzyme, certain enzymes, that is also known as, phospholipid.
Ma'am, you're muted. Excuse me, ma'am, you're muted.
Ma'am, we cannot hear
Cannot hear
you.
you.
Ma'am, ma'am, please unmute your mic.
Ma'am, where are you?
Ma'am,
Ma'am, ma'am.
We can't hear you, ma'am.
Ma'am.
Hello?
Yes, ma'am.
Yes, ma'am.
Sound is disturbing. I don't know why. Now it's clear.
Ma'am, you have been muted since long.
Yes, ma'am.
I don't know. I have muted. Somebody is muted me. I don't know. Now it is audible.
Yes, ma'am.
Yes, ma'am.
I think I have finished till here. This slide. Have you
No,
understood
ma'am.
this one?
You.
No. This
No,
figure. This figure. This mechanism of action of NSAIDs. Have you understood or not this one?
Ma'am, you are just repeating this slide.
Yeah,
You.
just and this one.
No, ma'am. Back.
I have
Yeah.
repeated this one, no?
No, ma'am. You were since then muted.
Oh, so this is the mechanism of how this NSAIDs work. Okay, first you should know how prostaglandin is synthesized. So this is a membrane phospholipid. Okay, this membrane phospholipid is present in the cell membrane of every mammalian cells. Okay, so we have membrane phospholipid. So this phospholipids is acted upon by enzymes that is known as phospholipase A2. Okay, this phospholipase is activated by certain stimuli like some chemicals, mechanical stimuli, or some injury is there. Then this phospholipase enzymes is activated, and this phospholipase enzymes is acted upon this phospholipid, and this phospholipase converted this phospholipid into the arachidonic acid. Okay, and this arachidonic acid is further divided into two pathway. They follow two pathways, either a cyclooxygenase pathway or lipooxygenase pathway. So if this arachidonic is acted by the cyclooxygenase pathway, and there is a synthesis of the different prostaglandin and thromboxane. When it is acted upon by the lipooxygenase pathway, then there is a synthesis of various leukotrienes like leukotriene A4, B4, C4, and D4. Okay, these are responsible for the various respiratory disease. So these leukotrienes also known as slow releasing substance for anaphylaxis, SRSA, because they are responsible for the anaphylactic shock. They are responsible for the various respiratory condition like COPDs and the bronchial asthma. Okay, now we are dealing this cyclooxygenase pathway because our drugs acted on the cyclooxygenase enzymes. So these cyclooxygenase enzymes convert arachidonic acid into the different prostaglandin isomer like prostaglandin E2, D2, and F2 alpha. Also, it also inhibits the formation of thromboxane synthase and and there is a formation of thromboxane A2 and B2. Likewise, it is responsible for the synthesis of prostacyclin, that is PGI2. So our drugs NSAIDs is acting over cyclooxygenase in
Ma'am, you are muted.
Hello.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
There is a problem. I don't know what is the. It's interrupting. Now am I audible?
Yes, ma'am.
Yes, ma'am.
Need slide change.
Yes,
Yes,
ma'am.
ma'am.
Excuse
Now
me, ma'am.
I'm saying, yeah.
Your headset is creating problem, I guess.
I don't know. Do you know any idea how to correct this? I think there is a problem in my laptop. Maybe problem in net. I don't know.
Ma'am, headphone can be removed.
Headphone.
Yes, ma'am.
Because I am using my mobile also. Because the sound is not coming from this laptop. So I am using my mobile also. Now am I audible? Hello?
Yes, ma'am.
I don't know. So we are talking about the mechanism of action of NSAIDs. Prostaglandin is synthesized. I think you should be clear with this figure. Any doubt in this figure? How the prostaglandin is synthesized? So why we are focusing this cyclooxygenase pathway? Because all the NSAIDs, the major mechanism of the action of all the NSAIDs for the various inflammatory condition and pain and fever. So our aim is to inhibiting the synthesis of prostaglandin. So we are dealing the cyclooxygenase pathway. Okay. So this cyclooxygenase enzymes is of two types. I've already explained. I don't know you have heard or not. Okay. So we have two types. One is the COX-1 and one is COX-2. The cyclooxygenase 1 is a constitutive enzymes, or it is also known as housekeeping enzymes. Okay, these are responsible for the synthesis of prostaglandin and other prostacyclin, which is responsible for the various physiological function like secretion of the mucus for the protection of the gastric mucosa and for the hemostasis and for the maintenance of renal function. Where this COX-2 is an inducible type, that is induced in case of inflammation and other pathological changes. So it is the constitutive types. So in some parts of our body, they are constitutive. They act as a constitutive like. Okay. Your microphone from the front.
Ma'am, we can't hear you. There's so much of disturbance.
From my side, from your side.